So in this video, we're looking at the differential diagnosis of schizophrenia. Differential diagnosis is the process of distinguishing schizophrenia from other disorders that present with similar symptoms. This is essential because treatment and prognosis differ across disorders. So bipolar 1 disorder with psychotic features. Bipolar 1 disorder is characterized by at least one manic episode which may be accompanied by depressive episodes. During severe manic or depressive episodes, individuals may develop psychotic symptoms such as hallucinations or delusions. Similarity to schizophrenia would be both disorders may present with hallucinations, delusions, disorganized behavior, poor judgment. Differences. The key distinction is a relationship between psychotic symptoms and mood episodes. In bipolar 1 disorder with psychotic features, psychotic symptoms occur only during manic or depressive episodes. In schizophrenia, psychotic symptoms occur independently of mood episodes and persist even when mood symptoms are absent. For example, a person who hears voices only during a manic episode with elevated mood, decreased need for sleep, grandiosity, and increased activity is more likely to have bipolar 1 than schizophrenia. Major depressive disorder, MDD, with psychotic features. Major depressive disorder with psychotic features is a severe form of depression in which psychotic symptoms occur alongside a major depressive episode. Similarities with schizophrenia may include both conditions may involve hallucinations, delusions, social withdrawal, poor self-care. Differences. In MDD with psychotic features, hallucinations and delusions occur only during depressive episodes. The delusions are often mood congruent, such as beliefs of guilt, worthlessness, poverty, or deserved punishment. In schizophrenia, psychotic symptoms are not restricted to depressive episodes and may include bizarre or persecutory delusions unrelated to mood. For example, a person who believes they have caused a global catastrophe because they are evil while experiencing profound depression is more likely to have MDD with psychotic features. Schizoaffective disorder. Schizoaffective disorder is schizoaffective. Schizoaffective disorder is characterized by a combination of schizophrenia symptoms and significant mood episodes such as major depression or mania. Similarities with schizophrenia, both disorders may present with hallucinations, disorders, disorganized speech, negative symptoms. Differences. The diagnosis depends on the timing of mood symptoms. According to the DSM-5-TR, a major mood episode, depressive or manic, is present for most of the illness, where there must also be at least 2 weeks of hallucinations or delusions without prominent mood symptoms. In schizophrenia, mood symptoms, if present, are brief relative to the total duration of the illness. For example, a patient experiences severe depression for... What has happened? My screen just went white. For example, a patient experiences severe depression for several months but also continues hearing voices for 2 weeks after the depressive symptoms resolve. This pattern suggests schizoaffective disorder rather than schizophrenia. Substance-induced psychotic behavior. This disorder occurs when hallucinations or delusions are caused by intoxication, withdrawal, or exposure to substances or medications. Common substances include cannabis, amphetamines, cocaine, alcohol during withdrawal, hallucinogens e.g. LSD, certain prescription medications such as corticosteroids. Similarities to schizophrenia, patients may experience hallucinations, delusions, agitation, disorganized behavior. Differences. The psychotic symptoms are temporarily related to substance use or withdrawal and often improve after the substance is discontinued and cleared from the body. Assessment should include a detailed substance use history, toxicology screening when indicated, review of prescribed medications. For example, a university student develops paranoid delusions and auditory hallucinations after heavy methamphetamine use. If the symptoms resolve after abstinence and treatment, substance-induced psychotic disorder is more likely than schizophrenia. So even if somebody seems to have schizophrenia, they don't necessarily have it. Maybe they are high on drugs or something, and then you realize when all of that stopped, everything was okay. Maybe you've taken a relative or you know somebody who is in rehab, and they get through the whole process properly, and when they come back home, they do not have any of these behaviors again. That's when you'll realize this is a substance-induced psychotic disorder. Psychotic disorder due to another medical condition. Psychosis can result from underlying medical or neurological conditions rather than a primary psychiatric disorder. By the way, I want to add, substance use can make schizophrenia symptoms worse. Let's go back to psychotic disorder due to another medical condition. Possible causes include brain tumors, epilepsy, especially temporal lobe epilepsy, stroke, traumatic brain injury, autoimmune encephalitis, thyroid disorders, vitamin B12 deficiency, HIV infection, lupus, Parkinson's disease, dementia. That is psychosis due to another medical condition, yes. Similarity to schizophrenia, patients may experience hallucinations, delusions, confusions, behavioral changes. Differences: the psychosis is directly attributable to a medical condition. There may be neurological signs, e.g. seizures, weakness, altered consciousness, cognitive impairment, abnormal physical examination findings, abnormal laboratory or neuroimaging results. Diagnosis requires comprehensive medical history, physical and neurological examination, laboratory investigations, e.g. thyroid function test, vitamin B12 levels, HIV testing where indicated, brain imaging, CT or MRI when clinically indicated. For example, a patient with untreated hyperthyroidism develops agitation, paranoia, and hallucinations. Treating the thyroid disorder leads to resolution of the psychotic symptoms, indicating psychosis due to a medical condition. And then I have a template for the summary table of disorder, key features, how it differs from schizophrenia. Disorders are bipolar 1 with psychotic features, major depressive disorder with psychotic features, schizoaffective disorder, substance-induced disorder, psychotic disorder due to another medical condition. Because we're looking at the differential diagnosis of schizophrenia. And that template is going to be on Canva. Link is in the description. You can download it. Let's move on to the next part.